Good morning, everybody. It is so great to see all of you here. So before I get started, if you're a member of the CFSI staff, can you please stand up? I know you're here. There are a lot of you here. These are the folks responsible for this incredible conference. So can I ask you a question? How many of you have pets? I'm not really much of a pet person, but I hear that cat videos are like a thing on the internet. And so I thought I would warm you all up this morning with a cat video. That was a little disappointing, I know. This is Socks the cat. Socks is a virtual pet, perfect for someone like me. And Socks belongs to a man named Bill Langlois. Bill is 68. He's a retired machinist, and he lives with his wife in a low-income housing complex in Lowell, Massachusetts. Bill's wife is out and about much of the day, and once Bill retired, he started to feel a little lonely. And Socks is his new best friend. Now, unlike a real cat, Socks can talk. In fact, Socks chats with Bill throughout the day. It can show him pictures of his wedding. It can play his favorite music. And Socks can also see Bill through that wide-angle lens on the tablet. And it keeps an eye on him. For instance, Socks might see that Bill has poured himself a glass of soda, and Socks might gently suggest that he switch it to water. Bill connects with Socks through a tech company called Care.Coach. The company employs patient advocates in places like Latin America and the Philippines, and they essentially operate these virtual pets, these avatars. They spend their days watching video feeds from the user's tablet and listening in to what's going on in the house through the microphone. And when they want to engage, they simply type in their response, and an Android text-to-speech reader then speaks the answer or speaks the engagement through the mouth of the avatar on the tablet. Now, Bill knows that Socks isn't real, but Bill loves Socks just the same. And he's not alone. Care.Coach did a pilot in Lowell recently, and they found that those people who received avatars needed fewer nursing visits, made fewer trips to the emergency room, and generally reported feeling less lonely. One woman who had been going to the ER a lot for social support essentially stopped when she got her avatar, saving her healthcare program $90,000. Victor Wong, the founder and CEO of Care.Coach, has seen how attached users get to their avatars, and he knows the power of the emotional engagement. He once said, "People can bond easily with anything that talks to them." Now, I learned about Bill and Socks the cat in an article recently in the New York Times with this headline: "Human contact is now a luxury good." Bill's story serves as a reminder of just how increasingly isolated we all are, starved for human contact. I thought technology was supposed to connect us all, but it turns out there's a difference between a Facebook friend and a real one. The theme of this conference is trust, technology, trust, tech, and transparency. But I think we left out a really important T word: touch. We usually talk about the trade-off between technology and touch, but For me, it's not really an either-or. The consumer and business benefits of technology innovation are powerful. And while it may seem counterintuitive, technology has the power to create even more human touch points. And so today, I'd much rather talk about tech and touch. You see, I think it's the winning formula for rebuilding trust, and trust is table stakes in improving financial health. Consumers need a baseline level of trust in companies and organizations before they're willing to engage. But as we heard yesterday from Deirdre Campbell, when she shared some of the top-line findings from the Edelman Trust Barometer, trust in institutions of all kinds continues to erode worldwide. One statistic from the report that really stuck with me is that only 20% of people believe this system is actually working for them. Now, trust in the financial services sector has improved in the last 5 years, but as you heard yesterday, overall, it's still the least trusted sector of any, except maybe the technology sector. Tech is facing a massive backlash in the wake of data breaches, privacy concerns, dubious business practices, and the growing unease with the fact that the platforms aren't the product, we are. How many of you have deleted Facebook or gotten off of another social media platform in the last year because of concerns about privacy? A few of you, quite a few, actually. Now, it's really important that policymakers and the companies themselves deal with and fix these privacy practices, but that alone isn't going to fully rebuild trust. Neither are slick brand campaigns, like the commercials that Apple is running on TV, showing images of padlocks as a way to tout their commitment to privacy. Digitizing trust is really challenging when it comes to financial health, because while technology is logical, money is emotional. Now, technology can verify that we are who we say we are, and that may be sufficient to give you comfort when you're getting ready to send someone money over Venmo or Zelle. And technology can certainly gather data on our connections and our searches and our transactions. But technology doesn't know our hopes and dreams. Technology doesn't know our greatest fears. One of the benefits of technology is the ability to automate low-value, repetitive tasks and shrink costs. But we risk taking that benefit too far by automating people out of the picture entirely. We have to pivot away from this idea that somehow robots are going to take over the planet and technology is going to become a substitute for all human touch. The fact is, human touch is core to our very beings. No matter how many hours my teenage daughter spends in her room, alone with Snapchat, she still needs a hug from me from time to time. This is the one that you sang happy birthday to last year, those of you who are at Emerge. Behind Snapchat and behind all the technology lie the relationships that are at the very heart of our lives. And it's relationships that are what's needed to help rebuild the trust that consumers need to feel before they're willing to share their financial data, talk about their money concerns, ask for help, and follow the guidance that they receive. Building real relationships in a digital world and in a cost-effective way requires weaving together technology and touch. Now, there are plenty of occasions on which using technology as a substitute for human interaction makes perfect sense. But technology can be even more powerful as an enabler of human engagement. Think about the last time you traveled for work, or maybe coming to this conference. How many of you used FaceTime to read your child a bedtime story, or to see a recital that you might have missed otherwise? I'm not at all suggesting that we put a halt to automation. I'm simply suggesting that we take just a little bit of the time and money that we're saving as a result of automation and invest it in human engagement. Think about it. The technology behind Socks the cat could easily have leveraged AI to create a series of automated responses to typical requests, kind of like a chatbot. But just because we can do something, it doesn't mean we should. I mean, we're talking about real human lives here. And so instead, the technology enables trained patient advocates to engage with more than one user at a time, dramatically reducing costs and enabling around-the-clock engagement that few of us would ever be able to afford otherwise. It's the other reason why the technology doesn't use the real voice of the operator of the avatar, because many of the users of these virtual pets have Alzheimer's disease or other kinds of degenerative diseases. The company wants to cut down on the confusion over when different operators are at the controls of the avatar at different times of the day. Most importantly, Socks is just a supplement to occasional in-person visits from a nurse or a therapist, and it provides caregivers, like Bill's wife, an opportunity to take much-needed breaks, feeling confident that someone is keeping an eye out for their loved one. A few months ago, I wrote an article about the idea of a self-driving wallet. I really want one. A Siri-like assistant that's part accountant, part budgeting guru, part fortune teller, that would constantly be monitoring and learning from our financial data in order to manage our money. Knowing how much we earn and owe, it could optimize when to draw down wages, when to pay bills, and when to set aside money for savings for emergencies and for longer-term goals. It would constantly be on the lookout for cheaper or better-suited products, and it would give us a heads up when there's going to be an upcoming bump in the road. I went so far as to suggest that building the self-driving wallet should be the moonshot of this industry, of the financial health industry. But just like with the self-driving car, the need for human engagement is still vital. Think about the company Brightside, which you just heard about a little bit in the last panel. Brightside is one of the companies from our last Financial Solutions Lab cohort. And it's a financial health platform offered through the workplace, like with partners like Comcast, to provide employees with a one-stop shop for managing their money. Brightside is marrying the efficiencies and insights of data with the nuance and empathy of financial assistants, real ones, not avatars. The technology automates many day-to-day tasks, And the financial assistants are there for more complicated issues, building relationship and providing support. A whole host of companies and organizations already engage with their customers and employees in ways that could be transformed into trust-based business models like Brightside has invented. By leveraging human relationships, companies can really build trust with their customers, providing real value to them and to their own bottom line. Think about other kinds of businesses, like think about when a customer decides to use their bank's mobile app. There's an opportunity there to show the customer their balance and to inject just a little bit of touch by offering them the chance to do a live video chat with a coach. My favorite example of something like this is Umpqua Bank's new Go-To app. The app essentially enables customers to choose their go-to banker by using a directory that's filled with pictures and lists of their areas of expertise and even their hobbies. Remember that cat video thing? It turns out that a mutual interest in cats is a fairly significant driver for the customers of Umpqua when they're deciding which of their bankers should be their go-to banker. Really and truly, I'm not making that up. The banker that's chosen ultimately receives all of the inbound texts that that customer is sending when they have a problem or a question. When asked about the rationale for this app, Umpqua's chief strategy officer, Rilla Delorier, put it this way: your hairdresser has a name, your babysitter has a name, your doctor has a name. Why shouldn't your banker, the person who is helping you with your money, have a name? Rilla believes that the bank first needs to build trusted relationships with their customer and prove that it can make good on basic requests before those customers are going to trust their banker enough to ask the could I, should I questions, the kind that can be really impactful on financial health and drive real revenue opportunities. Another great opportunity are with companies and organizations that already have high-touch models. Think about when a patient goes to visit a doctor, or when an employee is starting a new job and going through onboarding activities. This is the idea behind the new Blackrock Savings Initiative that we are leading in partnership with our friends from Commonwealth and Common Sense Lab. The idea is to help companies and organizations find those right time, right place moments to put short-term savings products in front of their customers and their employees. And we're looking for more folks to participate. So if this is interesting to you, I would really encourage you to join a breakfast that that team is hosting tomorrow morning. If we want to improve financial health for all, we all need to find more touch points, more opportunities to weave together technology and touch in ways that leverage and strengthen each other and ultimately help build trust. Because trust is the foundation of financial health. You've heard the word "and" a lot from me today. CFSI turned 15 last month, and we've been thinking a lot about the word "and" lately. It was 5 years ago that we launched a financial health network because we believed in the power of banks and credit unions and fintech startups and nonprofits and technology vendors and lenders and asset managers and insurance companies all coming together to improve financial health. Our experiences have taught us two things. The first is that financial health is bigger than the financial services sector can tackle alone. We need more companies and organizations at the table. More organizations that represent all of the facets of people's complex lives. Organizations that both have a stake in financial health and bring a complementary set of touch points. We need financial services providers and employers and colleges and hospitals and landlords and community leaders. We need them all here in the network. The second thing we've learned is financial health really does take a network. We need to continue to break down the silos, both within and across our organizations, and find new ways of collaborating with each other that reflect the way people's financial lives really work. 5 years later, it's become obvious to us that facilitating this network is at the core of everything we do. And so, to more clearly signal who we are, who we work with, and what we're trying to accomplish, CFSI is changing its name, starting now. I am thrilled to introduce you to the Financial Health Network. The Financial Health Network is the leading authority on financial health. We're a trusted resource for business leaders, policymakers, and innovators united in a mission to improve financial health for all. We envision a world in which everyone, including the most vulnerable, are able to achieve financial health by having the day-to-day systems they need to be resilient and thrive. A set of core beliefs guide our work. We believe financial health should be accessible by all. We believe financial health is good for business. We believe financial health requires a cross-sector approach. We believe financial health innovation is more than just technology. And we believe that deep consumer insights are central to improving financial health. Now, to be clear, we are the Financial Health Network. We are not FHN. We are so much more than an acronym. And we really want everyone to be clear about what we're really all about. Now, that said, our work will largely remain unchanged. We will continue to produce and share research and analysis, both on the financial needs of low and moderate income people and on the market opportunities to serve them well. We will continue to create tools and benchmarks to help organizations measure, manage, and improve financial health. We will continue to consult with organizations, uncovering important insights and building strategies that drive measurable results. We will continue to support and invest in innovation through tech startups and through partnerships and collaborations in order to drive scalable impact. And finally, we will continue to offer membership services to bring together everyone in the financial health ecosystem, spur partnerships, and develop best practices. The only thing that's going to change, really, the biggest thing, is that we're going to be doing all of this with a much broader array of providers. Employers, higher ed, healthcare, and others. This work, as Tanya alluded to earlier, isn't new for us. For instance, over the last 2 years, we've been working with a group of colleges and universities to help them figure out how to measure student financial health. The idea is to help them identify early and intervene with those students who are most at risk of dropping out because of financial challenges, and then help them to graduate. Likewise, we've been engaged in a whole set of workplace issues. And in fact, this afternoon, we're hosting an invitation-only workshop for employers to introduce them to this network and to discuss financial health tools that they can make available to their own employees. Our interest in financial services remains a constant, and we see even more opportunities to build financial health strategies in collaboration with a wide array of others. And it's a small but powerful word when it comes to both growing a network and improving financial health. Growing a network requires me and you. Building trust with customers requires technology and touch. I invite you to live the power of and commit to the financial health network. If you're not already a part of the network, please join us on our journey. Together, we can expand the financial health ecosystem with companies and organizations building trust-based strategies to improve financial health for all. Thank you.